Ever felt confused about your relationship with food? Where eating becomes more than just satisfying hunger, connecting deeply with joy, sadness, or stress? If yes, then this video is for you. Today, we will talk about a topic which perhaps in some way more or less is present among all of us, and that is eating disorders. So, let's understand this subject a bit more closely. Let's take a look at its main points. First, we will see what it is. How many types are there? What are its symptoms? What causes it? How can it be prevented? How is it diagnosed? How can it be treated? And finally, its conclusion. So let's start with the first point and understand each one in detail. The first question that comes up is, what is this eating disorder? Eating disorders are a type of mental disorder in which a person's eating habits are not normal. In this, a person either eats too little, eats too much, or has a tendency to expel food after eating. All these affect their thinking, feeling, and perception towards their body. If you want to watch this video in Hindi language, then click the I button or check description. So friends, now you might have a slight idea of what eating disorders are. Now let's move to the next point, where we will learn about its types. Let's get started. There are three main types of eating disorders. Let's start with, first, anorexia nervosa. In this type, you feel that you are too fat, even if you may actually be very thin. Therefore, you eat very little or sometimes not at all, just out of fear of becoming fat. Second, bulimia nervosa. In this, you first eat a lot of food, then feel guilty about it. After feeling guilty, you vomit the food you ate or do something else to ensure the food does not stay in the body. Third, binge eating disorder. In this condition, you lose control and eat a lot of food without stopping. But in this case, the person does not vomit afterward. These are the three main types where eating habits are not normal, and because of them, a person can face both mental and physical problems. Now, what are its symptoms or signs? Let's understand this. Eating disorders have some common symptoms. Let's look at these common symptoms one by one. Let's start with rapid weight change. If your or your friend's weight is decreasing or increasing very rapidly, meaning suddenly becoming much less or more, then it can be a sign. For example, if a person becomes very thin or fat in a very short time without any reason. Next, changes in eating habits. This symptom can be a bit complicated. Suppose someone used to eat normally, but now either eats too much or not at all. Or they don't eat in front of others, just alone or sneakily. Next, you feel that you are always fat. This means that when a person looks at themselves in the mirror, they feel they are fat, even if in reality they are very thin. This thought becomes fixed in their mind, and they can't get out of it. Next, feeling bad. After eating, some people feel guilty or ashamed after eating, as if they have committed a big mistake. They feel like they have done something wrong by eating. Next, starving yourself or over-exercising. Some people think that if they keep themselves hungry or exercise all day, they will become thin or not get fat. This becomes their way of controlling weight. Next, avoiding social gatherings. Some people avoid parties or family dinners because food is a central element there. They feel that if they go there, they will have to eat and people will watch them. This causes them anxiety. So, friends, these were some of the important symptoms. If you or any of your friends exhibit such signs, it's crucial that you seek help. By consulting a specialist or doctor, you can take steps in the right direction. Now, let's move on to the next point. What are the causes of this? Eating disorders, or disorders of eating habits, can have many causes. It's not just due to one or two things. A lot of factors work together behind it. Let's understand some of the main reasons, starting with mental pressure. Sometimes, people are not happy with themselves, their body, or their life. They underestimate themselves or think they need to be perfect. This mindset can lead them towards eating disorders. Next, social pressure. In today's society, there's a lot of pressure to be thin or to have a certain type of body shape. Seeing models or celebrities on TV, magazines, and social media makes people think they should look the same. This pressure is particularly high on young people. Next, family history. If someone in a person's family has had an eating disorder before, the likelihood increases. This could be due to genetics or the family environment. Next, stress. Changes in life or any kind of stress can also cause eating disorders. For example, pressure from studies in school or college, job issues, or problems in personal life. Next, hormonal changes. In some cases, physical hormonal changes can also trigger eating disorders. Next, personality traits. Some people are naturally more anxious, perfectionist, or self-critical. These traits can push them towards eating disorders. All these causes together increase the likelihood of developing an eating disorder in a person. These were some reasons why eating disorders can occur. Now let's look at the next points, where we will learn how we can prevent this from happening. Let's see, starting with building a positive body image. Learn to love yourself as you are. Do not be influenced by the unrealistic standards of the media or society. Next, open communication. Share your feelings with friends or family, especially when feeling stressed or anxious. Next, healthy lifestyle. A balanced diet and regular exercise, but in moderation. Avoid over-exercising or dieting. Next, seek professional help. If you think you or a friend is going through this problem, consult a therapist or psychologist without delay. Next, education. Increase awareness about eating disorders and mental health. Educate people about the signs, symptoms, and prevention of eating disorders. These are some important points, by following which we can avoid eating disorders and take good care of our health. If you feel anything is lacking in these points, or you want to share your strategies, please share them in the comment box so that we can help you and others. Now let's move to our next point. How is it diagnosed, or how is the examination done? For the diagnosis or examination of eating disorders, doctors or mental health professionals take certain steps. This process evaluates an individual's physical health, mental health, and eating habits. Let's understand how this examination is conducted. Let's start with, first, interview. Doctors or therapists. First, have an in-depth conversation with the patient about their eating patterns, thoughts, and emotions to understand which type of eating disorder they might have. Next, family history. Questions are also asked about the health history of the family, as sometimes genetic factors play a role. Second, physical examination. Physical condition is evaluated, including checking physical indicators such as weight, heart rate, and blood pressure. Next, blood test. Sometimes blood tests are conducted to look for nutrient deficiencies or hormonal imbalances. Third, psychological evaluation. Doctors or psychologists often use questionnaires or surveys to understand a person's thoughts, emotions, and behavioral patterns. Next, discussions. Discussions are also held to understand a person's emotional state and thoughts. Fourth, use of diagnostic criteria, DSM-5. Guidelines. The American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, DSM-5, provides specific criteria for eating disorders. Doctors use these criteria to confirm a diagnosis. All these processes help the doctor or therapist understand what type of eating disorder the individual has and how their treatment should be conducted. Now, let's look at the most important point. How can it be treated? The treatment of eating disorders is based on the individual's specific condition and needs. It requires a comprehensive approach that includes mental, physical, and nutritional aspects. Here are some common treatment methods. Let's start first. Nutritional counseling. Nutritionists or dietitians create a healthy eating plan that provides the body with necessary nutrients and promotes healthy eating habits. Next, educational sessions. Individuals are educated about the importance of food and its effects. Second, therapy. Cognitive behavioral therapy. This therapy focuses on changing the thoughts and behaviors that trigger the eating disorder. Next, family-based therapy. Especially in the case of young individuals, the family is involved in the therapy process to assist in the person's recovery. Next, group therapy. Sometimes, group sessions are also helpful, where individuals meet others facing similar issues. Third, medical treatment, health monitoring. Regular health checkups are necessary to identify any physical health issues. These were some important points on how eating disorder can be treated. If you think any points are missing, please let us know in the comment box and share your strategies as well. Now it's time for conclusion. Eating disorders, meaning the problem of eating habits, is a serious mental condition that can be corrected with timely identification and treatment. There are three main types: anorexia, bulimia, and binge eating. To prevent and treat it, nutritional counseling, therapy, and in some cases, the use of medications are recommended. This was our today's video, in which we first saw what is an eating disorder. How many types are there? What are its symptoms or signs? What causes it? How can it be prevented? How is it diagnosed or examined? And finally, how can it be treated? I hope you liked this video. If you found our video helpful, please share it with your friends, family, or colleagues so we can help them too. See you in the next video with the treatment of a new disease. Until then, a big thank you. And don't forget to like, comment, and share. Thank you.